It's Dr. Felicity Keogh here. Thank you so much for joining us today while we offer this informative event for you to have a more comfortable and healthy pregnancy. As you may have noticed, Dr. Mashinter is nowhere around, so my announcement is that she had her baby yesterday, and she is doing really well, and so is the baby. So she won't be here with me today. I'll be doing this solo. That's okay. So we're going to start off by saying, anywhere you are on your journey, if it's preconception, maybe you just got married and you're thinking about having a family, or you are now pregnant, or maybe you're 39 weeks pregnant, or maybe you're in the postpartum period. It really, any of this information that we're going to provide to you today, it does not matter where you start. Just going with the information and making those choices from here on out is what's important. So just let's get started wherever you are on the journey. So general overview of all the changes that take place structurally and physiologically during the time that you are pregnant. Some of those big ones are going to be changes in weight distribution. So if you're pregnant, you're going to gain weight, but it's not evenly distributed weight. It's all going to be on the front part of your body. So as your belly and abdomen grow, you're going to have more of an increase in the curve in your lower spine, which can put a lot of pressure back there and create lower back pain, hip pain, sciatic pain. Also, as your breasts grow, that's going to continue to cause this forward or this anterior shift in your shoulders and your head, which is going to cause strain in the neck and between the shoulder blades, which can cause neck pain, headaches, and pain between the shoulder blades. In addition to all of that, you have what's called ligament laxity from the increase in hormones such as progesterone. That's going to cause all your joints to be more loose, which in and of itself can cause more pain. So with that being said, I'm going to give 6 bullet points that will help you become more healthy and have a more comfortable pregnancy. So we're going to start with chiropractic care. Of course, we have to start with that because I believe that everybody needs chiropractic care, but most important time to get chiropractic care is when you are thinking about conceiving a baby, when you are pregnant, and in that postnatal period. There's no other time in a woman's life that should be as special and as sacred and hopefully pain-free. And we want women to remember their pregnancies as being comfortable and healthy and not look back and remember how miserable they were. And so often that's what women come into our office for. They're referred in by their doula, their midwife, or a local birth center, and even some OBs now are referring women to our practice, which is very, very exciting for us. And I'm friends with a few OBs, and they tell me that they had no idea that there were chiropractors in our area doing what we do. And I am here to say we're so blessed in this area. If you live in this area, we have a lot of chiropractors that do this type of work on the prenatal patient. So my OB friends are saying that I had no idea. What I tell my patients is to just suck it up until the baby comes, because that pain's really not going to go anywhere. And I'm here to say that is definitely not the case. So if you're having any discomfort or pain, you definitely want to find a chiropractor that's going to address those. And maybe you're not in our area, and that's okay. Write down this web address. It's www.icpa4kids.org. And that is going to help you find a prenatal chiropractor, pediatric chiropractor, somebody that's going to be able to help you in your area. You can do a search, put your zip code in, and you can find somebody very close to you that can help you with those ailments that you're having. In our practice, we are trained and certified in the Webster technique, and you may have heard of that. The Webster technique is an assessment as well as an adjustment to help balance the mother's body. So essentially, we are not going in and moving the baby. We're not doing that at all. What we're doing is we're helping the mother's pelvis, her low back, and all the fascia and the tissue around it, the abdomen and the baby, to become looser and more balanced. So mom can feel better, but then also so baby can become more properly aligned and prepare for the birth process. There's been studies that have shown that women who receive chiropractic care during their pregnancy have more straightforward labors, less intervention, and shorter labors, which every single mom wants that for their labor and their delivery. So adding in prenatal chiropractic, specific prenatal chiropractic using the Webster technique is very, very important. The second point we're going to talk about is good nutrition, blood testing, and prenatal vitamin. So if we think about, maybe we're not even pregnant, but if we think about what we eat on a daily basis, if we're eating junk food, we're building junk body. If we're eating healthy, nutritious foods, we're building a healthy body with healthy cells. So we really have to think about what we're eating prior to conception, during our pregnancy, and then in that postpartum period as well. So it all starts with a good, healthy diet. We promote things such as Whole30, we promote autoimmune paleo, we promote paleo anti-inflammatory eating, healthy fats. So we promote a lot of healthy eating, and that's really the foundational piece. Building on that is doing specific lab testing, functional lab testing, which we do in our office. Pregnant women should be monitored more than any other person during that whole pregnancy. They should be getting their labs tested. And most women that I know get about one lab test per pregnancy. So checking things like their thyroid, their iron status, their vitamin status, how well are they actually absorbing their nutrition and their vitamins from their food, blood sugars, liver, all of that stuff should be tested so we know that mom is in a healthy place to build a healthy baby. So getting those types of things tested can really help to make sure that we fill any gaps nutritionally in her body before she conceives, or even if she's already pregnant, we can pick up from there and really help her continue on that healthy pregnancy and having a healthy baby. Also prenatal nutrition. So we recommend the orthomolecular prenatal. This is, in my opinion, one of the best prenatal vitamins that you can get. It has the vitamins, the minerals, and it has the DHA that moms need when they are growing another human being. And then also important so it's really designed for pre-conception, prenatal, and then post-conception. So there's a lot of hype on whole food vitamins and how much better they might be. And just kind of a little snippet on whole foods. There's no regulation when it comes to the word whole foods. You can call anything a whole food vitamin if you really wanted to. Essentially what they're doing with the whole food vitamins is they're taking the extract of the food and they're putting it in the vitamin, and then they're using isolates to help get to the value that the label is claiming to have it on. So any vitamin cannot truly be whole food. And so we get a lot of questions on, well, is it whole food? Is this a whole food vitamin? I'm only going to take it if it's whole food. I'm here to tell you that no vitamins are truly whole foods. You have to use isolates to help fill in the gaps there to make that nutritional label that it's claiming to have. So this vitamin is USP certified. So these vitamins in here are of the highest purity and standards that you can get. Then of course the minerals and the DHA, the healthy fats that moms need and their babies need. Highly recommend that. The next bullet point we're going to talk about is sleep. So sleep is personally probably where I fail the most. Sleep is just one of those things that's hard to come by when you're a mom. Maybe you're pregnant and you have other children you have to care for. Maybe you're working. So sleep is really challenging, and especially when we become pregnant, it's already difficult to sleep because you're up urinating all night long and you're laying on your sides and your hips hurt. So your sleep quality goes down anyway when you become pregnant. So really stressing that when you become pregnant, you're going to need to find ways to make sure you catch up on quality sleep, because your body really can't heal and repair itself and focus on growing that healthy baby. Keep in mind, in the first trimester, the increase in progesterone can really cause a lot of fatigue. That's what progesterone does. So a lot of women are very tired in the first trimester, and we recommend trying to get really good rest as much as you can throughout the entire pregnancy, but especially in that first trimester, because as you go on, it just gets harder and harder to come by. So good quality sleep. And then the next point is stress relief. What is life without stress, right? That is pretty much life, is stress. If we had no stress, we would be dead. So we have to look at stress as stress can be healthy and it can also be unhealthy. So finding ways to manage your stress levels, whatever that may be. Maybe that's reading, maybe that's quilting, maybe that's going on a jog, maybe that's taking a hot bath, whatever that might be. Stress relief is so important. When women become very stressed, that increase in cortisol, that hormone, that can have long-lasting impact on your developing baby. So finding any way you can to put some stress relief in every single day in your life, especially during that pregnancy, the time that you're pregnant. And that brings me into the next bullet point, which is prenatal massage. For me, massage is one of the things I do to help lower my stress. It's amazing what that does for you, especially during the pregnancy. So we have 2 licensed massage therapists here in our office that are trained and treat a whole lot of pregnant women at any point in their pregnancy. So definitely finding someone that knows what they're doing when it comes to pregnant women is important. Prenatal massage is going to help manage your stress. It's going to help reduce pain. It's going to help reduce swelling and edema that can really happen, especially in the later phases of your pregnancy, improve your immune system, and help you to sleep better. So we highly recommend prenatal massage to every single pregnant woman that comes in to our practice. At least get one in your pregnancy. And then the last bullet point I want to talk about is different movement patterns and different stretching that you can do in the comfort of your home right now. I have to make the disclaimer, make sure you consult with your doctor before you do any of these things. But these are pretty simple, straightforward stretching that you can do that are specific to help with a lot of the hip, lower back pain that we get when we're pregnant. So I'm going to introduce you now to my demonstrator, Amber. Amber is here to help me today. We're going to start with sitting on the ball. So this right here, I'll have you sit right here. So I'll have you have a seat right there. And maybe actually turn your body a little that way. Ball sitting is extremely helpful at any point in your pregnancy. We recommend all women try to sit on a ball as much as they can. A lot of times when we work long days, we want to get home and kick our feet up and recline back. And that is very good for circulation for a time, but it's really going to be hard on the joints of the lower back, and it can encourage a posterior baby, which equals back labor a lot of times, and we don't want back labor. If anybody's had back labor before, you know what that's like, and we want to try to prevent that. So with sitting on a ball, a couple of things that are really important to remember. You want to have a nice straight back like Amber does right here. You don't want to be, go ahead and slouch for me. You don't want to be slouching like that because that's going to put stress on the baby and also the joints in the low back. And you want to have a nice straight back, and the key here is to make sure that the hips are higher than the knees. This isn't the best ball to demonstrate this on. Let's go ahead and get up and show them what it looks like without it. So this ball is way too small for Amber. She's taller, so she would need a ball that's going to be a little bit bigger. But what's happening here is the knees are at 90, almost like a little bit less than that. So what that's doing is that's going to continue to have the baby move in a less than optimal position. So now let's bring it back up here in this frame. So with the hips being above the knees, what you want is the baby's back to go on the outside of the belly. So you really want the baby's back to you want your belly to be like the hammock for your baby's spine. So it's going to really encourage the baby to go back out and not sunny side up, which a lot of times can happen if we spend a lot of time on our backs. So ball sitting is very important. Some women really start to get all moving with their joints, and that can really be helpful as well. The mailman just come in, so. Hi. So yeah, you can sometimes start to sway your hips and do circles on the ball, and that's going to really help to keep all the joints of the pelvis loose. So that's the first one. The second one is going to be piriformis stretch. The piriformis stretch is really great for women that are having a lot of pain down the leg, in the buttock and down the leg. So what Amber's doing is she's sitting really tall once again, and I'm going to have you actually go to this side. Actually, let's go turn to this side. Yeah. So her back is really tall, and she's crossing her leg over at 90. And the key here is to make sure that the foot stays flexed. And she's very flexible, so do you even feel this? No. So if you're not feeling the stretch, then you want to keep your back nice and straight, but you want to lean forward until you feel it. You feel that now? Mm-hmm. And she's not pregnant, so if she was, she probably wouldn't be able to lean this far forward, but this is going to really open up her hips and help with a lot of the pain that can be there. And you can really do this stretch anywhere, anywhere there's a chair. So this stretch is specifically for that piriformis muscle on the side. Now we're going to move into the hamstring stretching, a very gentle hamstring stretch. So let's actually have you lean up against that wall there. Yeah, so we're going to sit with your back up against the wall. So hamstrings get really tight, and that can be another really big contributor to back labor, less than optimal position for your baby, and back pain. So this is a gentle, safe stretch that you can do right now from the comfort of your home. What the keys here are: straight back once again, legs straight, so you don't want your knees to pop up. You want to keep your knees down, and you want your feet to be pointed straight up. Do you feel a stretch there? She's very flexible, so she's not feeling a stretch. So for somebody like you, this might not be ideal, but most of us are really tight in the back body, and this would cause a nice stretch. Go ahead and scoot your bottom away from that. If you're really tight back there, which most of you will be, you're going to want to not put your bottom up against the wall. You want to start with your bottom out a little ways, and then as you get looser and looser, you can scoot your bottom back up to the wall, just like that. So the goal with this one is 5 minutes, 2 times a day at minimum. I have women just sit up against the couch and do it right then and there. So that's the hamstring stretch. Let's see what's next. So now we're going to do side lying stretch. So we're going to use the table right here. Okay, so let's actually have you face this way so Amber can see you. Yep. So this stretch is nice to do when we are sleeping at night and we really have no choice but to lay on our hips because we can't lay on our back or our belly anymore. So this is a nice stretch to give your hips a break. Also helps with that piriformis syndrome and hip pain. So as Amber's doing, she's laying on her bed and she's got the leg going out to the side. And so you want to keep really good and stacked here. You don't want to really twist. Go ahead and show it. Twist really hard. So you don't want to twist your lumbar spine because that's not good for your baby. That's not good for the ligaments in your belly. So you want to really stay as stacked as you can. And some women will reach up and grab the leg and give yourself a little bit deeper stretch that way. And that's opening up all of this back here. So it really helps to give her some relief when she's trying to sleep on her sides at night. So this is called the sideline stretch. And just doing this as long as you want, really. You can do it all day long. You can stay in bed all day long. But most people can't.
That'd be nice.
Yeah. So that's sideline stretch. Put you up here. And then let's move into the diaphragm and the belly breathing. So now we're going to talk about the diaphragmatic breathing. So let me just start by saying most people that walk into our office or any chiropractic office, we've lost our ability to breathe properly. If you look at a baby, you lay a baby back on their back, you watch them breathing, they're going to be breathing from their abdomen. You're going to see their belly rising and falling. But when you ask somebody to breathe like an adult, take a big breath in. Yeah, you're wrong. So she's purposely doing that. But that's what most people will do. They'll breathe from their chest, just like that. And so you're recruiting all these muscles up here in the neck and shoulders. They call them your breathing accessory muscles. And that's going to cause a lot of pain and a lot of dysfunctional patterns in the body. So we've been conditioned to breathe like that. We have stressful lives. We want to have a little bitty waist. We don't want to breathe from our belly. So we just don't. So really teaching people how to breathe. So this time I'm going to have you keep your shoulders down and just try to breathe and push your diaphragm out. So that is the proper way to breathe. Her shoulders are staying level, and her diaphragm comes out on the in-breath and then in on the out-breath. So she's really working her diaphragm here, which is going to create more oxygen to her and her baby, more nutrition, and just a better feeling of stress relief. So that's really the goal when we work on proper breathing, and really, really stress that in pregnant women so their diaphragm can freely move. Okay? All right. So now, I missed one.
The floor one.
The belly, yeah, the tailored sitting. We're going to go back to the floor, so I'll have you sit right there. Tailored sitting is another one that's really good. If you're flexible enough, some people can't get down on the floor and do this, it's not a big deal, but this is just a really good stretch to open up the pelvis, to help baby get in a better position and help to relieve a lot of the stress and pain in the hips. So in this stretch, you're basically, show them Indian style, how you cross your legs. Like, however you do that. So that, the goal is not to do that, but the goal is to bring them back into that, flat position there. And she has a really nice, tall, straight back. There you go. So she's flexible enough to do that. Really great for her. If you were really, really tight, go ahead and bend forward. So some people are just really tight in their low back and their hips and they can't straighten up. I would not advise this stretch for somebody that was that tight. I would just advise you to sit on the ball and really try to work that and get looser that way and do some of the other stretches like the hamstring stretch before you jump into the tailored sitting. But this is a really great stretch if you have that flexibility in your hips to do that. Then I want to have Amber demonstrate the proper way to sleep, which is another one we almost forgot. Okay, so you can stay right there. So how do we sleep? That's what we get asked all the time. What's the best sleeping position? So we'll put one of these under your head, and you can face Mariah. So most moms are sleeping with a body pillow. Something like that, which is great. I mean, it's awesome, but after a while, especially in the third trimester, things really start to ache and the hips get really tired of having pressure on them. And so one way to really help alleviate some of that, some of it's just never going to go away, but is to bring this top leg forward. You need me? Okay, good. Sorry, more male. Okay, so this is going to allow for a suspended belly position, which is great because we want baby to, remember, we want their back on the outside of the mother's uterus, so that's going to make the best position for the baby. And it's comfortable for mom because she's not directly laying on that hip anymore. So this is a really nice position. It's called suspended belly sideline pose. Okay, so good?
Yeah.
Probably taking a nap right here. Okay. Then the next one we're going to talk about is Kegels. So you can have a seat next to me. Kegels are very important, and a lot of people know when you get pregnant you need to do lots and lots and lots and lots of Kegels. And I'm not of the school of thought that you need to do lots and lots and lots of them. I think they get more and more important, especially the further in pregnancy that we go. We just have to be smart. We don't want to over tighten those muscles because the pelvic floor needs to have some suppleness to it as well. So Amber is going to do some Kegels, but you won't even be able to tell she's doing them, right? But basically, the motion of the Kegel is to stop the flow of urine. So that action right there is what you want to help strengthen that Kegel muscle. And again, the pelvic floor gets really overstretched, especially in the later part of pregnancy, and we need to have good strength and good suppleness to that muscle. So Kegels are very important. I will show you another really simple way of strengthening the Kegel muscle. These are called weighted Kegels. I found it really challenging to get all the Kegels in that I was supposed to be getting in. I was too busy and I just couldn't remember to do them. So when I found this, it's on Amazon for $50. This basically has a whole bunch of different weights for you to simply insert, and actually just the action of holding the weight in is creating that, is contracting those Kegel muscles. And so putting that in for 15 minutes when you're getting ready in the morning, and then again 15 minutes at night when you're kind of tearing down and getting ready for bed. So that was helpful for me to make sure I actually did the Kegel action, but not forgetting them and trying to cram in 200 at the end of the night. So I really, really like this system. You can buy it off Amazon for about, like I said, $50.
Do you want to show those to them?
Yes, I don't know if you could get that real close. Got it? Okay. So, and then the last one we're going to show you is squatting. So we really want to make sure we do Kegels to strengthen pelvic floor, but we also do enough squatting to make sure that the other muscles are strong and the pelvic floor becomes nice and supple. So let's demonstrate some squatting. Let me move those pillows.
Can we do it from the side?
Yeah, I'm gonna grab these. Okay. So Amber's gonna do a squat. We want to make sure her legs are wide enough and toes are pointing out, and we want to try to keep the heels down. All right. So go ahead. Perfect. So we're gonna try to make sure your back stays straight. Yeah, there we go. And if you have to come up like she did a little bit, that's totally acceptable because we want the back to stay as straight as we can. Perfect. So let me show you what we don't want to do. So we don't want to do this. That's what we want to try to avoid. We want to try to keep the back tall and straight. And if we have to come up a little bit to do that, then that's what we have to do. But that is the ideal Kegel. So squat. One thing that you can do if your heels come up, so go ahead and pretend like you're tight and your heels come up. Some people just don't have that flexibility in their Achilles and their calf, so you can put a towel. This is going to do much, but you can put a towel back there to help with some of that balance, or you can simply put your hands down in front of you to give you some balance in that regard as well. So again, really, really good to do, especially as you get closer into the third trimester and towards the end, because it's going to help keep the pelvic floor nice and supple. You're good. You're good. Make sure I covered everything.
And I like to put my toes up when I do that, because then it makes me.
Oh, right. Yeah.
It forces me to stay on my heels rather than leaning forward onto my toes.
Yes. So yeah, that's perfect. It's just that balance that you kind of have to figure out. So these are all the stretches and the movement patterns that we have found to be really helpful for helping moms prep for birth and labor and delivery. And that's everything that we have for today. So I did forget to mention that there may be questions. Is there any questions, Mariah? No questions right now? If you have any questions that come up as you're watching this, or anything that we didn't specify or didn't talk about, and you need clarification on that, please don't hesitate to write us a comment, and we'll definitely get back to you as soon as we can. Thanks again for being here with me today, and I look forward to helping any of you guys. I will mention that we have a new patient special that allows for our patients to come in and get a prenatal workup or postnatal workup, and that's a $40 donation, which goes to our WISH ambassador, Cameron, whom we are literally, I think, a couple $100 away from reaching our goal, so we can send him to Disney. So if that's something that interests you and you want to get worked up and see if chiropractic is right for you, we'd love to be able to help you. Any questions, just give us a call, write us a message, and we will get back to you. Thanks. Have a great day.